Good morning, afternoon, evening, whenever you're watching this.
Welcome back to the Dr. Joe Show.
Welcome back to the Dr. Joe Show. We got a special episode today. We're over here at O2 Recovery with Omar, specialist in hyperbaric therapy.
How you doing, doctor?
Well,
Thank you.
Actually, no, I'm not saying. Well, welcome to the podcast.
To your
How about
podcast,
that?
yes.
We are in his oxygen suite studio,
Sweets. Yeah.
and this is where he does his oxygen treatment. So, why would somebody seek out oxygen therapy, Omar?
Well, first off, it's non-invasive therapy. I'm not going to touch you. Nobody's going to touch you. We're going to help you into the machine, and it's going to be oxygen and a little bit of pressure in the atmosphere. That's it. Mm-hmm. Nothing else. And oxygen's great for your body. I mean, since we were kids, that's all it's been coming in and the nutrient our cells and everything. So why not now?
Cool.
Afterwards. So.
Now, because of YouTube police, we should go over the FDA-approved reasons to undergo oxygen hyperbaric therapy. So there's 14 conditions that this is approved for. Air or gas embolism, carbon monoxide poisoning, decompression sickness, gas gangrene, severe anemia, so that's a hemoglobin like around 7 or less probably, crush injuries, compartment syndrome, intracranial abscess, necrotizing soft tissue infections, osteomyelitis, delayed radiation injury. So that's like your radiation exposed patients who've had cancer who had radiation therapy, right? Compromised grafts and flaps, which is just another word for infection, unless it's a blood flow issue. Altitude sickness and burns. I find it interesting that a significant number of the things on here are infections.
Yes. So again, this boosts up your immune system. That's oxygen.
How interesting.
Yes.
The crush injury, and then the crush injury. See, that's like an absence of oxygen. That means that there's compromised blood flow.
Right.
And compartment syndrome is another way of saying compromised blood flow.
Yes.
So this is all. So if I go back through this, and then air. So air embolism is compromised blood flow. Carbon monoxide is compromised oxygen delivery, which is the same thing. So all of this is just blood flow or infection.
Right. And for the most part, on most of our patients that come in, the first thing they notice is circulation. It helps them out, helps them relax, help them sleep. Once they walk in there, the first thing they feel is relaxed.
Huh. Have you ever seen anybody come in here, and I just thought of this right now. Have you ever seen anybody come in here who was told that they need to have an amputation? And they're trying to save their limb. Have you ever seen that?
I did. Unfortunately, the person didn't continue coming. He was more elderly. And he was coming in because he was recommended by one of the doctors to
try it out. What? Might as well.
Yes.
Can't reverse an amputation.
Of course.
Right? Yeah.
He was going to lose his toes, I believe, on his right foot.
Okay.
And one of the doctors have seen my ad off of Instagram. And he looked this guy up. I don't know, I've never met him. I don't know what's going on. He's like, but check it out. Yeah. So one of the ladies that was in there, one of the nurses, she looked it up and she sent the guy over here. And we had him in here and he left great. Second day he came in, he was all for it. And then, but of course, like everybody else, they want to see results. And this is a treatment. It's not.
They want a magic pill.
Yes, and I'm sorry, but we're not in that business yet.
I mean, an acupuncturist expert told me once, acupuncture, for example, it can take 10 to 20 treatments for the person's body to become sensitized to the effects of acupuncture.
Right.
And oxygen therapy, I mean, you can sometimes see results in 5 treatments, right?
It took me 5 treatments just to be able to sleep more than 3-4 hours.
So how did you get into this? What made you get into this?
Long story. I'm going to summarize as much as I can.
Okay.
I'm a vet. I was in the military.
Thank you for your service.
Thank you, sir. And I did a bunch of, I guess, medicine they gave us. Like I talked to you earlier about it.
Injections
They give us. So it is what it is. I mean, maybe it had something to do with it. Maybe it didn't. But December and January, I ended up in the hospital 4 times. This year. So December through January. I kept passing out, not unconscious, but still awake, being able to see, but it couldn't move. My mom suffers from MS. I thought it was maybe MS.
So they scanned your brainstem and your head
yes.
and everything.
They couldn't find anything.
Okay, so MRIs, check.
Everything was fine. So one thing led to another. On one of those episodes, I ended up getting my gallbladder removed. Actually, Christmas Day. My gallbladder removed on Christmas Day, and I ended up there by myself. So I had plenty of time to research. Actually, 4 days to research, and everything kept coming up to hyperbaric chambers, oxygen. So that was interesting too, enough that the nurse kept asking me. She was a veteran herself. She kept asking me, "Hey Omar, how's your oxygen? Your oxygen's super low. Have you been treated for this? Have you been treated for that? Like, you're a veteran. We know what happens." And like, "Hey, I don't know." And she said, "We've been exposed to a lot of things, and nobody knows exactly what it was." So she led me to it. Basically, I looked it up, and this kept popping up.
Do you have exercise intolerance, or you're able to exercise?
I do, yes.
Okay.
I'm okay. I can run.
So you don't have pulmonary hypertension?
No.
And so you have you had any scans, like a VQ scan? Does that sound familiar?
No, I've never had one.
But you never had blood clots, right?
No.
Okay, barking up the wrong tree. And he also told me, if you don't mind me relaying what you told me, EEGs, which is like looking for seizures, nothing. And you had a sleep study,
yes.
which did not reveal the cause of these symptoms.
No.
And it's not narcolepsy.
No.
And yet, so it's almost like a locked-in syndrome of sorts. Like you're awake and you just can't move and you're just laying there.
You're right.
This is bizarre.
It is.
And so that started happening. And when that started happening in the beginning of the year, when did you start doing hyperbaric therapy?
So right after that, I really got into it. I started studying, and I got a hold of one of the doctors, actually my wife's uncle, and he used to do hyperbaric because everything kept popping up. Hyperbaric, oxygen. You need oxygen. So I asked him. He's like, "Dude, that would work for you. It would work. I don't have a chamber now, but it would probably work for you." So then I got a hold of a company, called them up about the hyperbaric, and I'm like, "Hey, how did this work? What is this all about?" I didn't tell my rate on it. I wanted him to give me all the info. And so one thing led to another. Next thing you know, I got suckered in and bought one.
Okay.
So I bought one, and then I was like, I'm going to go ahead and get 2. And then I bought the second one thinking about my mom. And my mom has MS. She's got dementia as well. So I thought I got that one thinking about her and thinking about, I got nephews too, and they're out there sick. And according to all the studies, they help. So
yeah.
It helps with all that. So I figured, if I'm going to do this, I'm going to do it for anybody I can help. So I did it, and I helped myself to it. I'm not going to lie. I did 3 sessions. I was going to do a 5 session, boost myself up, basically. I did 3 sessions, and I was still sleeping 3 to 4 hours a night. So I called the doctor out. "Hey, man, what's the deal?" I'm like, "What do you mean? I'm not sleeping more than the 3 or 4 hours." Like, "Did you wake up?" "No." "Okay, bye." And I'm like, oh, that's when it clicked.
Yeah.
I'm like, okay. So it wasn't interrupted. So I slept 4 hours, non-interrupted. I got to the 5th session, 6th session. By Saturday, I was sleeping over 8 hours.
Wow.
Great. Woke up refreshed and ready to go.
That's insane.
So
that's amazing.
Yeah.
Now, when they said your saturations were low, what does that mean? How low was your oxygen?
I believe my wife saw the numbers, and she said it dropped down to the 50s.
When you had the episode?
Yes. And It was super low, and the nurse turned around, and when she saw, my wife asked her, "Is that his oxygen?" Like, "Yes, you need to get out of here." And they got him out, and they put the balloon and started pumping air into me, and and then I came back up, and I went like this, and they thought I was trying to punch him. So I was like, so next thing you know, we got to punch her. I'm like, I'm not trying to punch anybody. I'm okay. I'm thumbs up.
Oh my God.
Yeah.
Well, yeah. Well, that means they've been punched before.
Yeah.
Yeah. It's not their first rodeo for sure. Okay. Well, amazing. So you've alluded to the off-label use of this therapy. Are there any dangers to using this therapy?
I'm sure. I believe the only danger to it is, since these are really mild, are people that come in with because I had one already. People that come in with an infection, nasal infection, or some sort of sinus infection, and of course it's pressure. You're pressurized in there, so that's gonna build up.
So do similar rules apply like for scuba? Like you shouldn't go down.
Same thing.
Scuba. If you have, things going on up here.
Yes.
It's the
So
same thing here.
yes,
Okay.
same thing.
I just did this too 3 weeks ago. The video will be released soon, Yuma clinical trials, but he told me a little bit about it, but I was like, yeah, whatever. But yeah, it does creep up on you, and I have like pretty sensitive ears.
Oh.
Yeah.
So it does get intense. That's what I would say is the only downside, but
So like
he can control
So
it.
he has a sensitive issue.
Yeah.
With
Yeah.
this. Yeah.
He
So
can totally control it, but I didn't tell him.
yeah.
Okay.
So he didn't tell me anything, and then he's calling me on the walkie-talkie. Hey, is this supposed to happen? I'm like, yeah. Are you
I'm in
okay?
there chewing on my gum while
So after he's in there, the pressure's all the way up. He's like,
Yeah.
I kind of have issues with. I'm like, oh my God, dude, you should have told me that from the get go.
I mean,
even then though, it wasn't.
I mean,
that
I've
bad.
had
Like,
pain in my ears when
Uh-huh.
I go down to like 12 or 13 feet in the water.
This is about 10 feet.
Yeah.
This is like 10 feet. That's not much.
Yeah,
You'll
that's
be-
not
you'll be
much.
Fine. It's me. I'm
10
like
feet.
sensitive with that stuff, and even that, it wasn't that bad.
Yeah.
And then at the end of the day, I
Then
mean,
you can
this is-
adjust.
You can adjust.
Yes,
flow-
you make
flow
sure
out.
you
Well,
equalize.
He coached me through it.
Yeah,
and I was able to equalize it.
Yeah, that's the whole thing. If you
Yeah.
can't equalize, then you shouldn't be going in there.
And that night,
So
Right.
slept amazing. That night,
Yeah.
like I could clearly tell. I felt like how when you sleep like after a hard workout,
Yeah.
it was like that.
Interesting.
yeah.
Okay.
What I do, like for him, I if he would have told me ahead of time, I would have regulated the pressure,
He could regulate it,
and then just slowly increase that pressure until we get to the pressure we're looking
he
for.
knew. So by the time he took me down, because you're coming down too, he made it slower, like a softer landing. So it
Basic,
wasn't that bad
yeah.
on the way down.
They are called dives though, like you were saying
Wait,
right
they're
now.
called what?
Dives.
Dives.
So each session is called a dive.
It's a dive. Okay.
Yeah, they call them a dive.
That makes sense.
You'll have fun, man.
Yeah.
You'll get in there on the walkie-talkie, and we'll be able to actually talk to you.
Okay.
We can play soldier. And we can say you can say 10-4 if you want.
I said one small step for research, one giant leap for
For
mankind.
the Dr. Joe show.
For the
There you
so that'd be cool. But yeah, Omar's
Okay.
a good dude. Known him for a few months now, right?
Yeah.
This is a new business.
Since I
for
started.
you.
Yeah, it is. It
Your
is.
clientele's growing. You're actually
Yes.
expanding into a bigger suite here.
Yes, sir.
Double the size, maybe triple.
It's about double, yeah.
It's about double.
My whole plan was trying to get another one because I end up most of my people that I see, clientele that I see are looking for the bigger one to sit in.
That's the big. Yeah.
That's the bigger. This one you're laying down and reclining, but a lot of like my mom or other patients that come in have an issue sitting down
Yeah.
and whatnot. So we help them out on this one. And even if they had a wheelchair, we would probably be able to put the wheelchair in there or just pass them from the wheelchair into the chair in there.
There's been a lot of word of mouth. Like our video we did's not even out yet. Probably soon, like in a few days, once Daniel gets it. But word of mouth is really how he's been.
Yeah.
Well, I
gaining
mean, I have patients. I mean, I'm just thinking about some of my patients, and some people have this fatigue, and some people they come in saying, "I think I have long COVID," and long COVID's a very controversial topic.
It is.
As it is, and it's a moving target, but it's a constellation of symptoms. So, I mean, it just seems like if it might help, and it's not going to hurt you much, why
Right.
not?
The only thing we do, like if there's somebody with COPD, I wouldn't no, I would.
COPD. We're about to have a study here for COPD.
Yeah,
Oh,
so
okay,
a big
really?
contraindication to this therapy, folks, would be somebody with really bad COPD, and by bad I mean like severe.
Yes.
Well,
And,
that's the one
and,
we're
and
putting
they
in our
live
study.
at like 92% of oxygen, because if you over oxygenate the severe COPD patients, you can actually arrest their breathing completely.
Oh wow.
So
there you
so their oxygen receptors are acclimated to a lower oxygen level because of the extent of their lung damage over their life.
So
Right.
no chronic sinusitis
No.
and no COPD.
yeah, so no chronic sinusitis, no COPD.
No.
Sorry, Lana, she can't do it.
Yeah.
Or one of our employees.
Really?
Yeah.
Oh, okay.
Bad allergies,
Really?
man. And then like I said, you're gonna start seeing a bunch of COPD patients in our suite
And
for a
you're-
new study we're starting.
I mean, I think it would be an interesting discussion. I mean, I'm already thinking of another discussion to have on sinusitis patients. Like, is there any instance where ear, nose, and throat doctor would say, okay, I've scoped them and it's good enough to do this now? I wonder.
So that's the one thing I tell him. Like I have a patient. He came in He came in yesterday. He got cleared from cancer. He had testicular cancer. Great dude, great veteran, young, 25 years old. And I told him, well, if you're still on meds, I can't see you. I'm like, wait till you're done with your meds, or clear it with your doctor first
On medications.
on the medications
For
the cancer.
for the cancer.
Yeah.
Oh, like chemotherapy.
Mhm.
No, I
And
mean,
so I was
wouldn't-
like-
I wouldn't come near this stuff.
Yeah,
if
and-
you're on chemo, I
yeah.
mean, leave the oncologists alone. Let them clear the patient. Yeah, yeah.
Exactly.
Yeah.
And that's one of my biggest things, because again, a lot of cancer patients come and try to. I'm like, yeah, talk to your doctor.
Usually with chemo, it's like 3 weeks on, 1 week off. No, like 3 week cycles.
Yeah, it depends on the treatment, and it just depends on the patient's tolerance. And
Because now they do the oral chemo too. So.
Yeah.
there's oral chemo, there's immunotherapy, there's targeted therapy. There's so many more therapies now.
So he showed up. He was done with the medication,
Oh, okay.
and he tried it out, and he said him and his wife as well. That's the best sleep they had in years.
Yeah.
So I was like, great.
He probably still had severe anemia from the chemotherapy.
He said his energy are off the charts. He's like, he wakes us refreshed and ready to go. So I'm
You
like,
think
good,
it's
man,
the
it's working.
anemia or the neutropenia? Because this is for the immunity too.
Mm-hmm.
Well, I mean, I'm sure it helps for immunity, but it's FDA approved for severe anemia. That's why I thought
Right.
about it.
Correct.
Yeah.
correct. Interesting.
So he started feeling well, like within the second session.
I
So
wonder if the cancer patients that are complete with their treatments, like you mentioned, radiation, but also chemo, if it
Right.
can help get them back to normal levels of, immunity, white blood cells,
so
neutrophils, all that stuff.
yeah. So according to the studies, it's supposed to help with all that stem cells, start mobilizing them and start
Not FDA approved, but there's
right.
studies.
But there's
Right.
studies out there,
Yeah.
and they talk about that a lot.
the same FDA that approved aspartame, folks. Don't forget that.
Don't get him started. Do you drink Diet Coke?
No.
Okay.
Good. Good. This doesn't have to turn into an aspartame
Okay.
podcast.
I
Another
try
one
to
of
stick
those
to the.
we're due for another one of those, folks. It's been a little too long. But
Yeah.
I stick to the real sugar, if
Yeah, if
any,
you can do
or
it,
the
yeah.
bubbly.
The cane. Oh, the bubbly's good. Yeah, we got.
yeah,
Just the
polyphenols are very beneficial. There's a lot of benefits to, and that's in cane sugar. So, well, cool. Anything else you wanted to say about it in general?
No, that's it. I mean, it works. Everybody, I haven't had one person yet to say, this doesn't. Well, that one person I told you, that one veteran, he was pissed off of the world, so he showed up already like that, and I'm like, oh, put it in there, and I know I didn't feel nothing. I'm like, well, sir, it's not a pill, so it's not a magic pill like we talked about. But other than that, everybody's been loving it. First thing is, I see a lot of people for anxiety as well,
Anxiety,
Oh.
yeah.
and that helps tremendously.
Depression,
Wow.
I imagine too, with the sleep.
Yeah.
We have depression studies here, so
Yeah,
we have
I
some
saw
of our
that, yes.
clients now.
Yeah. So my anxiety patients, I got two favorites. One she was going to do 10 hours, 10 dives, and she got to their sixth one. And this patient was telling us that she would come over here. She would have to wear a hat, radio all the way down, gloves, sunglasses, and her mask.
Oh, boy.
Just coming over here, and she was just shaking on the way over here. So got to the sixth after the sixth session. She said, "Oh my God, you guys! Like, guess what? What? I just realized I forgot all my gloves. I forgot my glasses. I forgot everything."
Oh my goodness.
And I'm like, "Really? That's great." And she left her book in the chamber as well. So I'm like, "Hey, you forgot?" Oh yeah. And then she comes back. I forgot my keys. I'm like, "Great, that's awesome." I mean, you're forgetting things, but I mean, you're not
preoccupied.
The anxiety.
Yeah.
Yeah. So she was leaning on the anxiety to drive her life. Now she has to learn how to live again.
Yeah.
So that's pretty cool.
Yeah. And she comes in for her last one tomorrow.
Okay.
And she's one of my favorites. And then the one we were talking about that brought their kid, and this kid used to get up in the middle of the night and walk around the kitchen and just in circles, and so he would have to wake up and walk him back to the bed or lay him back down and tuck him back in. And so he didn't sleep because of that. On top of that, he suffers a little bit of anxiety and whatnot. So
Sure.
the same thing. He did 5 sessions, and he did with his kid. His kid did a session as well. He did a couple actually. He was sleeping right through it, and he started sleeping better to the point where Mother's Day came around, and he bought 2 Mother's Day packages, which was like 3 sessions of Hyperbaric and 3 sessions of red light. And he bought 2. Like, oh, cool. Is this one for your mom, one for your wife? No, actually, they're for me, and the red light's for my wife. I'm like, oh, great. So I'm like, he just got hooked on it, and he said he was never able to take a nap in the middle of the days, and now he can take a nap and just relax. So
That's so cool.
those are my 2
have
favorites
something
right
like
there.
this.
Yeah.
That's what I brought up during our Yuma one, the more local. That's so cool that Yuma has an option like this.
Yeah.
Yeah.
And it's all natural. I mean, it's just oxygen
Yeah.
and a little bit of pressure. That's it. So
I love it. Cool.
you ready to try it?
Okay.
Yeah.
I guess I'll try it out.
Yeah. I'll
Take
put
a dive, man.
Yeah, take a dive.
Yeah.
Right.
We'll see how that goes.
Yeah, these are the surgical booties.
Yeah. We just use. I'll get.
Oh, you got it? Okay.
I'll get you the full service like I normally do all our clients. I'll let you go in with a gun, but normally we don't let people go in with guns or knives.
You don't?
No.
Oh, in case they go psychotic?
Yes.
But, I mean, I should secure it, right? I mean, I shouldn't leave it there.
Nah, that's fine. You go ahead.
I mean, you're... Okay.
I got you. And I'm sure you know how to work this.
Oh, yeah.
If it warms up a little bit in there, you got 2 fans, one on this side, one on this side. Just turn them on. There's a little button on the back. And then you'll be all right. And you take a break whenever you need to take a break from the oxygen. Just put it back on. You might get a little bit of a rubbery smell. It's the new line, so.
Kind of standard, yeah.
Yep. And then these are our grounding sheets.
Grounding?
Sheets, yeah. It's a hippie thing.
Wait, so...
This is all
So
grounding.
I shouldn't have shoes on?
You're fine with them. We let people with the shoes on. Normally, this, from what I know, is this should be on your feet or use it as a sheet. But since we're
My
doing...
sister got me some grounding stuff, actually.
Oh, did you really?
Yeah, she did. I just haven't put
Okay.
it together yet.
Oh, okay. But these are it. This goes straight in through one of these outside to the grounding on the wall.
Right.
Yeah.
And then you can check to make sure it's grounded. Yeah, my sister got me this box of...
Uh-huh.
Yeah, there's a mat, and then there's...
Yeah.
You put it on your bed. And,
Yeah. So that's basically what this is. They both have them.
Oh.
You can be on your phone if you want to be on your phone. Did you leave your phone out here?
No, it's just in my
You got it?
pocket.
Okay. All right. If you want to be on it, it's fine. It's not full of oxygen. It's just air. The only oxygen is here. Yeah. So, ready?
Okay.
All right. You're gonna feel a little bit of pressure. Just go ahead, equalize. Okay? Yeah. Do not open the zipper when it's fully inflated. Okay? Because you can bust the zippers off. So. And then I'm out 16, 20,000.
Oh my god.
Just like when you scuba before, right?
No.
No? Oh, okay. Oh, you threw it out there. I thought you knew.
I mean, I knew about it, but I
Okay.
didn't know everything.
So it's like scuba diving. You hold your nose and like you're gonna blow out, but you keep it all in.
yeah,
Yeah.
and it pushes out your ears.
Power on. 1. Power on. 1. Check.
Hola, Aurora. ¿Cómo está? Hasta el uno más.
I feel giddy.
He feels
and,
good though.
Okay.
I felt like
Calm.
like nothing really different. Just
Awake and yet lightheaded.
more relaxed because I have to sit there.
That's what I was telling him. He's gonna come out and he's gonna feel really relaxed.
Yeah. Yeah, I feel okay. I just feel really relaxed. Neato.
How was it?
That was pretty good.
Yeah.
Where does this go?
I'll get it.
You got it? Okay.
One small step for man, one giant leap for sucralose.
Well, I feel pretty good.
Yeah?
Yeah. I felt really giddy. And I felt like I was regressing to when I was in college. Like mentally. It was actually kind of weird.
Really?
Yeah.
Serious?
Yeah. Yeah. I mean, it was almost like it was easier to meditate. With oxygen, it's like easier to meditate. You're less distracted.
You
So I
are.
think next time
Yeah.
I'll do
Well, there we have it. Hyperbaric oxygen therapy.
O2 Recovery LLC.
I'm going to go run about 5 miles, and we'll see you guys later.
Awesome having you, Doc. Thank you. Appreciate it.
Thank you.